Dr. Jose Pelayo, and I'm here for just a little tune-up on my face. I think I have a couple of years inside. I'm a little younger than when I look on the outside, so I want to make sure that it balances.
We have another very special patient. Today we're doing a trifecta, as we call it in my office, kind of the deluxe facelift offer, which includes what's referred to as the Maercks lift, or the deep plane composite lift that lifts most of the mid-face and carries the neck, lateral neck lift, and a submental lift. So those three things work together to get everything from the eyes down as refined and natural looking as possible.
You know, as age advances, you notice that there's skin lag. You know, we have what's called elastin in your skin. It's elastic fibers. They drag, they get, you know, gravity weighs on you, and there's a certain part of you that wants to look a little bit better, a little younger. And again, I don't want to look 20, but I just want to look a better version of myself.
The recovery profile that I generate for my patients sometimes even surprises me. In women, where we do this technique usually the next day, less than 24 hours later, if they shower and wear their hair down, their lunch or dinner presentable. Men tend to swell more, bleed more, and bruise more. So, like, bets are slightly off with men. That being said, most of my male patients in the first few days are really presentable depending on their expectations, and everyone has a different idea of what kind of swelling is not acceptable and what is. The other confounding factor is men typically have short hair. So while women can wear hair down, there's always recovery behind the ears, around the lobule in this area. So that's evident. So it just depends on the individual patient. But in general, my patients in the first few days look like a traditional facelift at 3 to 4 weeks.
Well, I think it's going to go smooth. I mean, Dr. Maercks is super qualified. Researched him for a while, had great conversations with him, and I feel real comfortable about that. So, but I want to just say, you know, walk out of the procedure nice and safe, and there's some improvement, not a complete, you know, ugly look, but just a nice little tune-up to a aging face.
So I'm about 15 years into practice. It gets easier because I have a certain reputation. So people that come to me generally are looking for the most natural result, the most minimal, tasteful kind of intervention, and kind of are usually aligned. So when people come to me, they're usually already looking for me. So that makes things easy. And then when you meet a patient and you discuss kind of what the findings are, I always let the patient speak first, then I share my findings and thoughts. And if a patient is very aligned with the things I say, it makes it very easy.
Absolutely. I mean, besides, you know, we're all clinically trained, so we all have licenses, we all went to school, we have passed our boards. So clinically, we should be the same. What changes is your connection with the person, right? With the doctor in this case, and that's super important. And I think anyone who's going to choose a physician needs to make sure that's part of the equation to choose a physician. And in my case with Dr. Maercks, it was just instant connection. He's a very, very humble, nice person, even though he's a very sophisticated surgeon.
You're welcome to hang, you're welcome to do whatever you want. We're about to get started with the first case of the day, a really special case, a fellow physician who's entrusted me to perform his facelift. So we're gonna do what we call a trifecta here, kind of affectionately at the Maercks Institute, where I do the Maercks lift, which is our kind of a deep plane composite facelift, where with minimal dissection, we elevate the whole face and neck together as a composite monoblock unit. The lateral platysmoplasty, the extra tightening, so the bi-directional tightening, and also the submental lift. Importantly, takes the fat underneath the skin out, then underneath the muscle, and tightening all the structure of the floor of the mouth. So this goes way up. So we got the way up, the way back, and then natural elevation, making a beautiful natural result. So come on in and follow me through it. Male composite facelift, neck lift, and submental lift, and a really kind of challenging case for two reasons. Copious amounts of excess skin and lots of fat on the superficial and deep planes. So to get this done safely and effectively, to take a lot of care, because in the fatty tissue in a big neck, it's easy to get disoriented, and there's a lot of important anatomy there. So a lot of slowing down, taking your time, precisely trimming the fat, identifying each structure step by step. And we took out this huge piece of fat about this big from the superficial compartment and a decent size of fat from the deep compartment, restructured all those muscles. And then there's always that point in the case with a male facelift with this much skin and that much fat excision. As you imagine, it's like deflating a balloon. So we take out all that fat and tighten up the muscle, and the envelope is so huge. There's a moment in the case after the submental lift where I look at like, oh my, how am I gonna deal with all the skin? There's always a point in the case where I get really worried that there's all this skin, because it seems like this copious amount of redundant skin cannot be redraped, but that's the power of these three techniques together. The deep plane facelift, we just do everything right and get that vertical oblique support, which takes up a lot of the deep support and the lateral support. And we have a point in the filming where we show you, once the support's done, the skin just wants to fly off the face. So all that's left is trimming it, making it beautiful. We took our time, we did it right, and this will be one of the most epic faces I've done. So can't wait to share the results with you.
The expectation is I was curious how it was going to turn out. It appears to be, right? This is the first day after the surgery. It appears that it's going in the right direction. I couldn't tell you exactly where it's going to end up, but at least the first look, it appears it's going in the right direction. It looks like a younger me, but it looks natural, which is what my expectations really were hoping for. I'm 62 years old, so I feel healthy for a 62-year-old, and now my face hopefully looks a little bit better than before I came here. It's pretty amazing that I feel this good after a day, maximum a day and a couple of hours. So I was expecting, this is expected after about a week. So after a day and a half, it feels really good.
Let's get you over to, does that hurt?
We all want to be done in 2 days, but it's obviously the body goes through its normal physiology, the swelling, and every time you cut, there's swelling. So the major issue that I have right now is not an issue, just a major, what you see is just a swelling. Because when you cut tissue, when you bruise tissue, you're gonna swell. So this is completely normal. It just will take a week, I think. 4 or 5 days a week, and 4 or 5 days a week is pretty amazing. Listen, what I would suggest is do your research, but you're gonna end up picking Dr. Rian Maercks. He's just the best in class. He's a physician with a lot of skill. He's an artist as well. So that is, and forget about the other two parts, but the empathy is incredible, the staff is incredible. And I hope that when you do choose, you choose correctly. And if I were you, I'd choose Dr. Maercks.